Blood cancer, also known as hematologic cancer, is a type of cancer that affects the blood, bone marrow, and lymphatic system. It originates in the blood-forming tissues and disrupts the normal production and function of blood cells. There are several types of blood cancers, but the three main categories are leukemia, lymphoma, and myeloma. Leukemia is a cancer that primarily affects white blood cells, which are responsible for fighting infections. In leukemia, the bone marrow produces abnormal white blood cells that do not function properly. These abnormal cells can accumulate in the blood and other parts of the body, crowding out healthy blood cells. There are several types of leukemia, including acute lymphoblastic leukemia, ALL, acute myeloid leukemia, AML, chronic lymphocytic leukemia, CLL, and chronic myeloid Lymphoma is a cancer that affects the lymphatic system, which is a part of the immune system. It can develop in lymph nodes, lymphatic vessels, or other lymphoid tissues. Lymphoma is categorized into two main types, Hodgkin lymphoma and non-Hodgkin lymphoma, NHL. In Hodgkin lymphoma, abnormal cells called Reed-Sternberg cells are present. NHL is more common and has many subtypes, each with different characteristics and behaviors. Myeloma, multiple myeloma, or myeloma, is a cancer that develops in plasma cells, which are a type of white blood cell that produces antibodies to help fight infections. In myeloma, abnormal plasma cells accumulate in the bone marrow, interfering with the production of normal blood cells and leading to problems like weakened bones, anemia, and kidney damage. The exact causes of blood cancer are often not well understood, but there are risk factors that may increase the likelihood of developing these diseases, including genetic factors, exposure to certain chemicals or radiation, and a weakened immune system. Symptoms of blood cancer can vary depending on the specific type and stage of the disease but may include fatigue, unexplained weight loss, frequent infections, easy bruising or bleeding, and swollen lymph nodes. Diagnosis typically involves blood tests, bone marrow aspiration and biopsy, imaging studies, and other specialized tests. Treatment options for blood cancer vary based on the type and stage of the disease but may include chemotherapy, radiation therapy, stem cell transplantation, targeted therapies, and immunotherapy. The choice of treatment depends on factors such as the patient's age, overall health, and the specific characteristics of the cancer.